Hi there, my name is Kathy Klein, and today we're going to talk about Medicare prescription drug plans. This is one of the most confusing areas of Medicare, and yet it is so important. My clients ask me about this all the time, so I thought I would put together a drug plan primer just for you. So let's take a look. Now, first of all, you need to know that there are a couple of different ways to get your Medicare prescription drug coverage. The first is through a standalone prescription drug plan that works with Original Medicare. I normally see this option when somebody has a Medigap, also known as Medicare Supplement Plan. The second way is to get it through your Medicare Advantage prescription drug plan, which covers medications and health care. To be eligible for a standalone prescription drug plan, you must be entitled to Medicare Part A or be enrolled in Medicare Part B. And don't forget, you must reside in the plan's service area. To get your coverage through Medicare Advantage, you must be enrolled in both Medicare Part A and Part B. Now let's talk about what's covered. Each plan has its own formulary, which is just a list of drugs that are covered and at what level. The formularies are not standardized. This means that the plans decide which drugs they will cover. And they can choose to cover any drug as long as the drug is within these four areas: available only by prescription, not over the counter, approved by the FDA, used and sold in the United States, and used for a medically acceptable reason, but not off-label. One thing that you should know is that insurance companies can cover the same drug in different levels, and we'll talk about that in a minute. There are tier levels, and each company's tier levels vary. That's what I just said. Tier 1 would be preferred generics, and these are what the insurance company deems as the least expensive drug. You're going to pay the least copay on a Tier 1. Tier 2 drugs are also considered to be generic drugs, but they're going to be a little bit more expensive than the Tier 1 drugs. Tier 3 preferred brand are going to be even more expensive, and these are brand name drugs, not generics. Tier 4 is your non-preferred brands, and these will be even more expensive than Tier 3. Tier 5 specialty drugs are typically for people who have been diagnosed with a chronic disease, and they are expensive. And so Tier 5 is normally going to be your most expensive drug. Tier 6 would be select care, and these are for normally specified conditions that the insurance company designates. So what's excluded? Certain drugs cannot participate in the Medicare Part D plans. These include, but are not limited to, drugs that are prescribed for the following conditions: fertility, sexual dysfunction or erectile dysfunction, hair growth for cosmetic purposes, anorexia, weight loss or weight gain, symptomatic relief of cough and colds, insomnia, prescription vitamins and minerals, and all over-the-counter or non-prescription drugs. You do not have to sign up for Part D right away, but keep in mind that if you don't, you could incur a penalty. And keep in mind that that penalty will last as long as you are in the plan. It's not a one-time penalty. A lot of people do get caught in this trap. In fact, my own husband got caught in this trap, and this is the whole reason why I started working with Medicare insurance. Now, you do not have to sign up for Part D if you have creditable coverage. And creditable coverage is drug coverage that pays on average at least as much as Medicare's standard drug coverage. This could come from, say, an employer plan. And when you have creditable coverage, it does protect you from paying that late enrollment penalty when you do finally move to Medicare's Part D program. Creditable coverage can come from VA benefits, like I said, an employer group plan, an employer group retiree plan. It could come from a union plan. Just check to make sure that it is considered creditable. You should be receiving notices if you have creditable coverage. One thing that I want you to understand is that Part D is completely different from group and individual programs. Unlike your work or individual plan, there are 4 benefit phases, which include the deductible, the initial coverage, the coverage gap, and catastrophic coverage. Most of the group plans and individual plans that I've seen only include deductibles and what we would consider initial coverage. They don't normally include a coverage gap or catastrophic coverage. So be sure to compare your prescription drug plan with your employer plan if you have one. In 2018, the deductible is $405. The initial coverage limit is $3,750. The out-of-pocket threshold is $5,000. And for catastrophic coverage, it's $3.35 for generics, $8.35 for non-generics, or 5%, whichever is higher. And I'll explain what these mean in a moment. So, of course, you're probably familiar with deductibles. That's how much you must pay before the plan kicks in. The initial coverage phase is probably similar to what you're used to, where you pay a specified amount for each drug. And you will pay that until the initial coverage limit is reached on a Medicare drug plan. So, as I said previously, the initial coverage limit for 2018 is $3,750. Keep in mind that this is what you and the insurance company pays. It's not just what you pay. And so don't fall into the trap of thinking that the $3,750 is tallied up by just what you're paying. It's not. It's tallied up by what you and the insurance company is paying together. The donut hole, or the coverage gap, begins when you've reached that initial coverage limit, which in 2018 is $3,750. When you're in this phase, your costs normally go up because then instead of paying your specified copays, you are going to pay a specified percentage for generics and a specified percentage for non-generics. And this changes every year. Once you've reached the catastrophic limit, then your costs change again. And at that point, your costs will normally go down. And the catastrophic coverage percentages vary each year, but it is usually a percentage or 5%, whichever is higher. Now, your true out-of-pocket costs are calculated on an ongoing basis, and they include the annual deductible, the coinsurance, the copays, your costs for covered drugs, the drug discounts, and any payments made by CMS on your behalf. It does not cover drugs that are out of the formulary or drugs that are not covered by Medicare or drugs that you purchase overseas or by other means. One thing to keep in mind is the pharmacies must be in network in order to have your drugs covered. And if you use an out-of-network pharmacy, your drug is probably not going to be covered. So you should definitely stay in network. But on top of that, most plans have preferred pharmacies and standard pharmacies. You'll want to stay in a preferred pharmacy if you want to save the most money. Some drugs are covered under Part B instead of Part D. And usually these are drugs that are administered by a physician, but some can be under Part B that are not. So for example, insulin. If you have an insulin pump, that is a Part B medication. So if you're on original Medicare with a prescription drug plan or without, that's going to be covered under Part B. But if you are on a Medicare Advantage plan, it might be covered separately under the drug plan. So keep that in mind. So some of the Part B medications include insulin when used with a pump, some antigens, some osteoporosis medications, oral anti-nausea drugs, Part B chemotherapy drugs, some oral cancer drugs, injectable drugs, hemophilia, clotting factors, and drugs for end-stage renal disease. So that's it. That's your Part B primer. Now, we didn't cover everything, but I just wanted to make sure that you had a basic understanding of how Medicare drug plans work. So I hope this helps. And now that you've taken this primer, you can go on to our 7.5-minute course on how to find the cheapest drug plan based on your medications. So thanks so much, and we'll see you in the next video.